Welcome to Salute and Biohacking Podcast. My name is Vanessa Bertinotti and my mission is to build an Italian-speaking tribe that shares my same passion for health optimization and biohacking by bringing to the table experts and people who inspire me. All the information contained in this podcast is purely informative and does not replace medical or therapeutic consultancy. On this episode, I'm super excited to welcome Patrick McKeown, one of the world's leading breathing experts. Patrick is creator, CEO, and director of education and training at Oxygen Advantage, director of education and training at Buteyko Clinic International. He is a leading international expert on breathing and sleep, and author of best-selling books including Asthma Free Naturally, Close Your Mouth, The Oxygen Advantage, and The Breathing Cure. His mission is to empower more people to breathe better, feel better, and achieve their potential. Patrick, welcome to the show.
It's a pleasure. Thanks very much, Vanessa.
I'm really thrilled to have you here. Thank you for joining us today. In this episode, we will learn why healthy breathing habits are just as important as healthy eating habits, and the fundamental relationship between oxygen and the body. First of all, before we dive into today's topic, we have to tackle your background. Can you tell us about your journey, how you got to where you are now, and why you have decided to research on breathing?
I suppose it's like anybody who falls into this field, you normally fall into it because of your own personal issues. I think most people who teach breathing ultimately go into breathing because of their own health background. So mine was asthma and poor sleep, and I was a chronic mouth breather, as many people are. Waking up with a dry mouth in the morning, not waking up feeling refreshed, and mouth breathing typically then is engaging the upper chest, and you're breathing faster, and that activates more of a fight or flight response. So say, for example, in school and high school, your concentration is impacted. So I came across an article in a newspaper, and it spoke about a Ukrainian doctor, Konstantin Buteyko, who said to breathe through your nose and to breathe light. So I was practicing that, and it made quite a difference pretty quickly, I might add. I also taped my mouth closed. I did use nasal dilators just to make sure that I was able to breathe through my nose. And within a couple of nights, I was waking up in the morning and I was waking up feeling refreshed, So I experienced firsthand the benefits of changing breathing patterns. And it's kind of surprising that despite breathing being taught in different modalities for decades, none of the modalities were touching on breathe light and on breathing from a biochemical point of view. And none of them were talking about the importance of nose breathing. So Vanessa, yeah, that was it. It was life-changing for me, and that's why I changed careers then.
Interesting story. And why learning how to breathe correctly is so important, and why correct breathing has become extremely challenging in our modern society?
Well, I suppose, first of all, we have to ask the question, what is correct breathing? What's normal breathing? Is it what you see in studios? People taking these full big breaths in and out? Or is normal breathing just simply in and out through the nose, undetectable light breathing, driven by the diaphragm with a natural pause after exhalation, with a regular breathing pattern? That's normal breathing. Normal breathing isn't the hyperventilation exercises. Normal breathing isn't filling your lungs to maximum capacity with the belief that the more air you breathe, the better it is. So it's really about getting back to basics. And I think ultimately about breathing, it's understanding that if you are doing exercise involving hyperventilation, what does that do to the body and mind? If you are taking full, deep, big breaths, what is that doing to the body and mind? And it's really with an understanding of that, then you can tweak breathing exercises according to whatever you want to get out of it. So we live in different times now, when you think about originally when breathing was developed, or breathing exercise developed, mindfulness developed, life was different back then. Nowadays, 2,000 years on, or a long time on, people are prone to to stresses, chronic stress especially. And breathing patterns change. And even when the stress is removed, that dysfunctional breathing pattern can continue. So if we were to look at people with anxiety and panic disorder, 75% of this population have dysfunctional breathing. And all it means is that their breathing is a little bit upper chest, breathing a little bit faster and harder, irregular breathing patterns with some, mouth breathing with some. And it's almost as if that breathing pattern is feeding into the stress response, and also for people with asthma. Because, if you think about asthma as being a respiratory condition affecting about 8 to 10% of the Western population. And when you have asthma, you have inflammation of your lungs, and that inflammation of the lungs travels up to your nose, so the nose is stuffy. Then you're more likely to breathe through an open mouth. You're taking cold, dry, unfiltered air directly into the lungs. You're also bypassing the nose because your nose harnesses a gas called nitric oxide. And this in turn then is going to feed into narrowing of the airways. So the conditions themselves, by changing our breathing patterns, are feeding back into the condition. And it's a vicious circle. And it's, I would say, to people that the very hierarchy of breathing, if you were to consider it so, nose breathing is the absolute foundation. And then light breathing, because has anybody, listening, have you ever tried actually breathing less air? What happens when you breathe less air? What happens when you really slow down the speed of the inhalation coming into your nose, and you're having such a relaxed and slow, gentle exhalation to the point that you have air hunger? And what does that tell you? What does that signify? It signifies that carbon dioxide is increased in the blood. And as carbon dioxide is increased in the blood, it helps to open up your blood vessels. And it also increases oxygen delivery from the red blood cells to the tissues and organs, including the heart and brain. So it's kind of ironic, Vanessa, that we live in a world that we feel that bigger is everything, bigger is better. But when it comes to breathing, less is more. And I'm not saying about under breathing. I'm not saying about depriving your body of air. But what I'm saying is getting rid of the belief that it's fundamentally important to be taking these full big breaths, because that's all we seem to hear. And as long as we're doing that, there's a risk of hyperventilating. And as a result of that, blood vessels constrict and less oxygen is delivered. So, can you imagine going into a studio and the instructor instructs you to take these full big breaths, and you're increasing the volume of air that you are breathing? You're blowing off too much carbon dioxide. This is driving up blood pH. This is causing your red blood cells to hold on to oxygen. This is causing your blood vessels to constrict. And, if people realized what the breathing technique is doing, I think they would change it.
Yeah, it makes perfect sense what you're explaining to us. And for listeners who don't know about nitric oxide, can you walk us through what it is and which role does it play in our body? Can you give us some background on that, please?
Sure. Nitric oxide, there's different forms of it, different isoforms. Nitric oxide is produced inside in the blood vessels, but the nitric oxide that I'm talking about is nitric oxide that's produced in the paranasal sinuses, or at least that's where it's believed to be produced. So this gas was first identified on the exhale breath of the human being in 1991. And by breathing through your nose, you're carrying nitric oxide into your lungs. So by breathing very soft and slow through your nose, or by doing breath holding or humming, you can increase nitric oxide. So you're carrying that nitric oxide laden air into your lungs, and nitric oxide helps to redistribute the blood throughout the lungs. And this in turn improves gas exchange, so oxygen can pass more readily from the lungs into the blood. And the other thing about nitric oxide that's interesting is that it's antiviral. So we've just been through, of course, pandemic that everybody knows about. But how many people were actually instructed to breathe in and out through the nose? Harness your own antiviral response. So nitric oxide is a bronchodilator. It's antiviral. It helps to open up the blood vessels inside the lungs to ensure gas exchange and to improve it. It also helps to redistribute the blood throughout the lungs. So it's a very important gas when it comes to respiratory health. And the thing is, if we breathe through our mouth, we bypass nasal nitric oxide. So I feel it's unfortunate because the very people who need to harness nasal nitric oxide very often breathe through an open mouth. People with asthma, people with COPD, people with respiratory conditions, people who are feeling that they are not getting enough air. And this can often be due to airway narrowing. So, you feel that your airways are narrowed, and it's a very natural response is to switch to mouth breathing to alleviate the feeling of suffocation. But by switching to mouth breathing, you're involving more of the upper chest, and you're wasting more air to dead space, but you're also bypassing the properties of the nose, the function of the nose. So, even though in the short term you may feel more comfortable getting rid of that feeling of air hunger, but in the long term you're not helping your airways whatsoever.
I see. And how much air should we breathe for optimal health?
Well, I suppose, when we're thinking about the air that we breathe, it's not just about the respiratory rate. We have to consider what's the volume of air that we breathe per minute.
Okay.
And normally when breathing is considered, you're thinking about, okay, how many breaths per minute do I breathe? But it's not just about the number of breaths per minute that you breathe. It's also about the size of each breath. So a normal for an adult would be in around 10 to 14 breaths per minute with a tidal volume of about a half litre to give you a minute ventilation of about 4 to 6 or 4 to 7 litres of air. So that would be considered normal. Now, how many people are breathing 16, 17 breaths per minute? But you could also be breathing a normal respiratory rate, but having an increased tidal volume. So ultimately, it's not about the respiratory rate. It's not about the tidal volume, but it's about minute ventilation. What's the volume of air that you are breathing per minute? And the rule of thumb that I use is that if I can see people breathe quite easily during rest, it's not a good sign. Now, I mean quite easily, that if I just see they're breathing and if I can notice they're breathing, it's not a great sign. And those same people, they're more likely to be overly breathless during physical exercise. They're more likely to breathe harder during sleep, which increases resistance to breathing. And I remember saying, it's coming from Master Chris Pei, he's a master of Qigong. And I was watching a video on YouTube. It's going back a long time now, about 10 years ago. And he said there are 3 levels to breathing. And he said the first level of breathing is that the person next to you does not hear you breathe. So you can imagine you're breathing that the person next to you doesn't hear you breathing. And the second level of breathing is that your breathing is so smooth that you do not hear your breathing. So during rest, we shouldn't hear our own breathing. And he said the third level of breathing is that your breathing should be so smooth that you do not feel your breathing.
Wow.
So ultimately, people with good breathing patterns, it's quite difficult to detect their breathing. And it's coming back to normal breathing. Their breathing is light, their breathing is slow, their breathing is low, their breathing is through the nose. And there's also a natural pause at the end of exhalation, and their breathing is effortless. And, if we consider what is that breathing pattern telling the brain, when we breathe with functional breathing patterns, the body is telling the brain that everything is okay. And it's got a calming effect, increased vagal tone. The autonomic nervous system, the automatic functioning of the body is in better balance. So it's really by changing our breathing that we can change physiology. And for me, breathing is the most important function in the human body. That's well rehearsed statement that people talk about. You can live without food for weeks, you can live without water for days, and you can live without air for just a few minutes. And people talk about food and the quantity and quality of food, and they talk about water, the quality of the water you drink and the quantity, how much should you be drinking every day. Not too little, not too much. But what about air? So people talk about, okay, quality of air is important, but what about the quantity of air? How much air should you be taking into your lungs? And many of us have a habit of over-breathing. Many of us have a habit of breathing up our chest, breathing harder, breathing faster, and all that's doing is keeping us stuck in a more fight or flight response and feeding into our symptoms.
Yeah, it's fascinating. And how mouth breathing affects children?
Well, I suppose the mouth has no function whatsoever. It's a hole, if I wanted to be crude about it. You breathe through your mouth, that air goes straight into your lungs. And the nose has many important functions, but especially for children who are mouth breathing, their tongue isn't resting in the roof of the mouth, and as a result of that, they're more likely to develop jaws that are set back and jaws that are not wide enough to house all teeth. So it's not a good sign when a child has overcrowding of teeth. And it's not because the teeth are too big, it's just that the jaws are too small because the jaws haven't developed the way they should have developed. And the issue with small jaws is that there's not enough room then for the tongue in the mouth. And the tongue then is more likely to encroach the airway. And this in turn can increase the risk then of sleep disorders. And how important is it? Well, Dr. Christian Guilleminault, who is considered to be the founding father of sleep medicine, he spoke about the critical importance of restoration of nasal breathing, both during wakefulness and sleep in children. And I remember, he's since passed on now, sadly, but I remember at a conference in Bordeaux, he stood up, he was giving a presentation, and he said that children's brains are getting fried as a result of mouth breathing and poor sleep. And I always remember that analogy. The brain is getting fried. And then I read a paper by Karen Bonnock. She studied 11,000 children in Stratford-upon-Avon in the UK. And she studied these children from 6 months to 57 months. And she was considering the relationship between poor sleep and the development of the child. And she spoke about the child's brain develops during slow wave sleep. But if a child is mouth breathing or snoring or stopping breathing, it's disrupting the child's sleep. The child is having sleep fragmentation, and this in turn is affecting the brain development. So she spoke about 3 million children aged between 6 and 21 years of age in the United States who have conditions associated with sleep disorders. So I think, Vanessa, this is something that's so fundamental. We've been talking about the importance of restoring nasal breathing in children for 20 years, and yet most parents aren't aware of it, that if your child has the mouth open, it can impact the development of the jaws and face and airway, but it can do more than that. It can impact the development of the brain. And of course, it's not going to affect all children the same, but there's a risk there. And if, for example, the child's airway doesn't develop the way it should do, that child then has a risk of obstructive sleep apnea for the rest of their life. You know, I'm one of those kids. There's millions of children in the same situation. And even when you go to an orthodontist, so you can imagine then that child with overcrowding of teeth goes to the orthodontist, and the child may go to one orthodontist, and that orthodontist may say, okay, what we need to do is develop your maxilla and make room for the existing teeth. And the benefit of that is that there's going to be more space in the mouth for the tongue. But you might go to another orthodontist, and the second orthodontist may say, well, the problem here is that the teeth are too big, so let's extract 2 or 4 teeth. And that second orthodontist is extracting teeth and making the jaw even smaller. The problem was that the jaws were too small anyway. Now the jaws are even smaller again, and have increased the risk of sleep disorder breathing again further. So different schools in orthodontics. One school is considering the airway and the other one isn't. And straight teeth don't make a beautiful face, but if the face develops the way it should have developed, with the tongue resting up in the roof of the mouth, it follows that the teeth will be straight. So a good looking face, it follows that teeth will be straight. But straight teeth don't make a good looking face.
Yeah, interesting. And what should the parents do when they see their children with the mouth open and breathe with the mouth during the sleep? So you have developed this myotape, this like tape that goes on the mouth also for children. So do you suggest to start in which direction?
I think the first thing to do is to assess, say, for example, and make sure the children are able to breathe through their nose during wakefulness, you know. So, for example, children would come into us, into the clinic over the years, and the first thing we would do is have them wear paper tape during the time that they were with us. They're with their parents. And we give them simple breathing exercise to help open up the nose. And then I have the children do different exercises with nasal breathing, including jogging, walking, skipping, star jumps, whatever they're doing. Because ultimately I want to see, can these children actually breathe functionally through the nose? Why does the child have the mouth open? Does the child have the mouth open because of habit, or is it because of nasal obstruction? And we can use breath hold exercise to help open up the nose, to decongest the nose, the front of the nose, but not the back of the nose. So we're looking to get an idea of why does this child have the mouth open? And if the child has the mouth open due to enlarged adenoids, which are lymphatic tissue right at the back of the nose, which is blocking airflow through the nose, that the child feels uncomfortable breathing through it and then switches to mouth breathing. It's not just that the adenoids are enlarged, but it's likely that that child's airway is undeveloped as well. And for me, a dentist who understands about airway and development of the child's face is so vitally important in this, because it's a very brief window of opportunity. I can't remember exactly the stats in terms of, I think it's 60% of the face is grown by about age 4 and 90% by age 12. And so we would always start off with nasal breathing during the day. And when we're comfortable that the child is able to breathe through the nose during the day, then we would introduce myotape during sleep. And all of the exercises are available as well. We have an app, Buteyko Clinic, and all of the exercises for children are available from that app. So the nose and blocking exercise, the jogging, the steps exercise, slow breathing, they're all there. So children then can be practicing this. And I think ultimately it's about the parents putting it into practice. The best results that we've seen are when the parents put it on board, and the parents are breathing through their nose during sleep. And even just to think about dental health, like you go into a dental practice, you'll see a poster up on the wall, and that poster will be talking about the importance of brushing your teeth for good oral health, the importance of eating good foods and not to be eating sweets and sugary foods because these are going to damage your teeth. But the dentist should also have another poster, and that's the importance of nose breathing, because if you have your mouth open, your mouth is dry, bacteria is more rampant, you're more prone to gum disease, dental cavities, bad breath. So there should be two posters. One poster about the importance of brushing your teeth and good dental hygiene, but the second poster should be about the importance of nose breathing for good oral health.
Fantastic, fantastic idea. And so you are also speaking to dental people, or are you doing like specific courses to them, or it's just something that it's on the way?
Over the years, we've had quite a few people, dentists and orthodontists, attending our training. Last week I spoke at the American Academy of Physiological Medicine and Dentistry, AAPMD, and also the AAOSH. And that was attended by 750, primarily dentists and orthodontists in their field who understand about airway.
Wow. Okay.
So, we've had for about 17 years dentists attending our courses, and because dentists, I feel, are in such a unique position, they're looking into the mouth of both the child and the adult, and they can identify the risk factors for sleep issues. Men don't typically go to their medical doctor very often unless there's something wrong. But a man who is more prone to sleep disorder breathing than a female will attend their dentist probably every 6 months or so. So you can imagine a 45-year-old man. He's going to his dentist. And as he lies in the chair, the dentist, of course, is looking at his teeth. But the dentist is also looking for other factors. Does this man have scalloping of the tongue? Does this man have a high palate? Does this man have jaws that are set back? Does this man meet the criteria that's putting him at risk of sleep disorder breathing, including obstructive sleep apnea? And that dentist then would be in a position to say, even to have him fill out the Epworth sleep scale, or just to encourage him, listen, might be no harm just doing a sleep study, because the anatomy is telling me that you could be prone to sleep disorders. But of course, the dentist isn't able to diagnose it. It's only a medical doctor who can do it, a sleep doctor. But at least a dentist may be able to nudge the patient to go and do something about it. There are millions of people, adults and children, going into dental practices, going in with their mouth open, having all the risk factors of sleep disorders. They're walking in one door and they're walking out the other door. So, unfortunately, it's not that all dentists know about this. That's unfortunate, because I don't know why this hasn't been taught at universities and dental schools. The dentists who know about the airway are typically those that oftentimes I feel is when they were working with their own children and they realized there was something not quite right here. And from working with their own children, they then decided to do further investigation and did further training in terms of, learning about the importance of sleep and the relationship between the mouth and the airway, etc. So not all dentists are the same, not all orthodontists are the same, but that's the way it is, and that's the way it is in every field.
Absolutely, yeah. And what is Buteyko method? Can you explain the physiology behind the Buteyko breathing exercise?
So Dr. Buteyko was a Ukrainian doctor, and when he was sitting with his sick patients, he noticed that the sicker they became, the faster and harder their breathing patterns were. And he asked a question, he said, what's causing what here? Is it their sickness which is causing them to breathe harder and faster? Or could it be that their faster and harder breathing is feeding into their sickness? So he started teaching them to breathe in and out through the nose, because of course the nose is the only organ that does anything in terms of breathing. And he also taught them to breathe light, really softening and slowing down the speed of the air coming into the nose and having a really relaxed and a slow and a gentle breath out. And the whole purpose was to do it by relaxation to a sensation of air hunger. So in other words, to underbreathe. And by underbreathing, carbon dioxide increases in the blood. And as carbon dioxide increases in the blood, you have a sensation of air hunger. But as carbon dioxide increases, blood pH drops. And hemoglobin, which is the main carrier of oxygen, releases oxygen more readily to where it's needed in the body. And also by breathing light, blood vessels dilate. So on a very practical level, when I first started doing it, I always had cold hands and cold feet, always, for many, many years. And I first sat down to breathe less air, and I noticed that the temperature of my hands increased, that I was able to influence my blood circulation in about 3 to 4 minutes. And very often when we practice this, we also experience increased watery saliva in the mouth. And even though we're feeling that slight air hunger, which is a bit uncomfortable, the body and mind is going into rest and digest. And we know that by virtue of the increased watery saliva in the mouth, because when the body is prepared and ready for the digestion of food, the mouth produces more saliva. So if we think about meditation, like I've seen 3,000-4,000 people coming in with anxiety over a 3-year period. And none of them, very few, I'm not going to say no, none, but I would say very, very few of them continued with a practice of meditation. And I was there thinking to myself afterwards, why is this person with anxiety not meditating? Well, there's so many thoughts going through their head, they're living in their head, they're feeling tense, they're feeling anxious. And if we start bringing our attention to the mind and to our thoughts, it can amplify our thoughts to make us more anxious. If we start bringing our attention to our breathing, it can make us more anxious. So the tools in terms of with the Buteyko method, there's different breathing exercises. So even if somebody comes in with anxiety, we can help to down-regulate, to activate the relaxation response and dampen the stress response, to improve and increase blood flow to the brain and oxygen delivery, and to have a calming effect on the brain. By even practicing breathing exercises that you don't even have to focus your attention on your breathing. So it's going way beyond mindfulness, even though mindfulness is wonderful. But mindfulness is about awareness of the breath and the body and present moment in the mind. But yet we can get very quickly to a state of calmness and relaxation by simply changing our breathing patterns. So the physiology of Buteyko is not really known. You know, Dr. Buteyko said it was about carbon dioxide, but carbon dioxide is part of the picture, but it's not the full picture. I think the main thing that we're doing with Buteyko method is that we're helping to bring balance to the autonomic nervous system. Because people who are sick, people who are unwell, either mentally or physically, they're typically in an increased stress response. And as long as we're in that increased stress response, it's going to feed into our condition. And then the question to ask is, can we really help our condition if we are continued in a stress response? So we need to set up the factors that help the body to heal itself. And those factors include bringing a balance to the autonomic nervous system, and breathing and sleep are pivotal here.
Yeah. And you create your own breathing work training program called Oxygen Advantage, which continue to develop and grow in line with your clinical experience as a breathing coach and with the latest scientific research. Why did you decide to broaden out Oxygen Advantage? Because you had the Buteyko method, and why then starting a new method?
Yeah, we still teach Buteyko as well. In 2010, I started putting out courses. Ireland was in a very bad place economically. There was a lot of stress. People's houses had devalued by 50%. Many people were out of work. And a lot of people were struggling emotionally. So I put out courses to bring together mindfulness with functional breathing patterns. And as I said earlier, 3,000 people attended these courses. It was over a 3-year period, but 95% of the people who attended were female. So men weren't coming to the course, and I was just wondering, why is it? Why don't men come to mindfulness and a functional breathing course? So I said, okay, this is where Oxygen Advantage is. I started writing a book then, in around that time, 2012. And the whole book was about physical and mental performance. And it was about being able to change our physiology, to change our states, to improve our focus, our concentration. It was about being able to do breath hold exercises, running with the mouth closed, improving oxygen delivery, helping open up the airways, improving function of the diaphragm. And it was giving people, specifically it was aimed at men. So it was aimed at men to give them a technique about mental and physical performance. Now, by practicing that very same technique, we helped to address anxiety and panic disorder. Because if we think of even, somebody coming into me with a lot of mind activity, and they can't stop thinking and they're living in their head, they don't just have a lot of mind activity. They're constantly absorbed in thought, ruminating in thought, but their concentration is impacted. Their ability to focus is impacted. And by giving them the tools to improve their concentration, those same tools are going to bring a quietness and a calmness to the mind, and even to enter flow states. That state of mind whereby you're fully absorbed in what you're doing. And many people understand this. And we haven't been trained how to concentrate. Like, we go through 16 years of formal education. Many of us, most of us. Education doesn't teach us how to concentrate. And mindfulness isn't going to work for the very person who needs it the most. And also the question to ask is, if one has sleep disorder breathing, and if one's breathing is fast and shallow and the central nervous system, including the brain, is in a state of increased stress response, it's going to impact our ability to concentrate and also to be mindful. So I think there's a fundamental question here. What is the hierarchy in terms of helping to bring a calmness and a stillness to the mind? We need to get our everyday breathing patterns right. That we learn to breathe light, low, slow, and in and out through the nose. And by improving our everyday breathing patterns, we're helping to bring the autonomic nervous system into balance. But also by improving our everyday breathing patterns, it helps with our sleep. We're less likely to have snoring, to have obstructive sleep apnea. We're more likely to wake up feeling refreshed. And for me, when I was waking up feeling refreshed with my mouth closed, my tongue resting in the roof of the mouth, it's the ideal scenario to to have focus and concentration of the mind. So there are plenty of people doing mindfulness, but they're waking up with a dry mouth in the morning. There are plenty of people doing mindfulness, but they're breathing fast and shallow. And there's plenty of men who won't want to do mindfulness because they don't feel it's for them, but they might be keen to practice strategies that help to bring a balance to the autonomic nervous system to improve physical and mental performance. Because if we think of the people who are doing this, like I've worked with people in the Special Weapons and Tactics, SWAT, Navy SEALs, Delta Forces, Royal Air Force, our own emergency response unit here. I've worked with snipers, with elite athletes. And these guys and girls are already at the top of their game. And they're practicing breathing techniques to be able to change their physiology to get that 1% more. Now, if it's good enough for them, it's good enough for everybody else.
Mm-hmm. Yeah, it's so fascinating. And you are talking about also athletes. What about HRV, so the heart rate variability, that it's so important for marginal gain? So how can we optimize our HRV with breathing technique?
Heart rate variability is a measurement of vagal tone. It gives you some idea of where the autonomic nervous system is. So, for example, what we spoke about earlier on, if you're in that increased stress response, you're going to have reduced heart rate variability. But if you're in balance, you're going to have optimal heart rate variability.
Mm-hmm.
So, in terms of practicing the breathing techniques, we use breathing techniques to help to bring balance and to improve heart rate variability, to improve vagal tone. And for me, it's very, very important. The research out there, because breathing has been too left of field for so many decades, and now the research out there over the last 30, 40 years, optimizing heart rate variability, and so many people are wearing devices and gadgets. Now, the devices are giving you feedback of your HRV, but the techniques to optimize heart rate variability will include breathing patterns. And traditionally, a breathing rate of slowing down the respiratory rate to between 4.5 and 6.5 breaths per minute was seen as the optimum breathing rate to practice to optimize heart rate variability. But also breathing light, that really soft and slow, gentle breathing, taking a very soft and slow, gentle breath in through the nose and a relaxed and a slow and a gentle breath out to the point of air hunger. That helps to strengthen the baroreflex and stimulate the vagus nerve. And by doing that, then you're helping to optimize heart rate variability. Nose and low breathing. So as you breathe, that you feel that the lower ribs are moving outwards, and as you breathe out, that the lower ribs are gently moving inwards, because it's the lateral expansion and contraction of the lower ribs, which is a good gauge of functional breathing patterns with using the diaphragm, with good recruitment of the diaphragm. That helps to stimulate the vagus nerve.
Mm-hmm.
Having a really relaxed and a slow and a gentle exhalation helps to stimulate the vagus nerve. So we think of this vagus nerve as a nerve that's wandering throughout the body, innervating the major organs, with 80 to 90% of the feedback or communication is from the body up to the brain. And by stimulating the vagus nerve, you help to improve vagal tone, and you help to bring the autonomic nervous system into balance. And when we're in that scenario, we're more optimal to reach our full potential.
Mm-hmm.
But, many people, we're just the human nature of things are like, I could be working with a professional athlete, and that athlete has been prone to trauma, perfectionist tendencies, burnout, all of the stresses that go with it. And that's going to impact their vagal tone, and that's going to impact their performance.
Mm-hmm.
Sleep comes into it. Like if one has sleep issues, insomnia, heavy snoring, stopping breathing during sleep, waking up with a dry mouth in the morning, that's going to reduce their vagal tone. So ultimately, helping to bring the body and mind into balance is about breathing exercises, physical activity, with the mouth closed would be ideal, of course, and good sleep patterns. And that's the ideal recipe. So heart rate variability opens up and brings in the science because, breathing, I want to take breathing and the idea of breathing out of the left of field. It's not about, and the reason being is because I think as long as it's too left of field, it just puts people off. And it puts off the normal individual out there who needs it. I was listening to a podcast by this brain surgeon. He was talking in it to a Dr. Rangan Chatterjee, and I often use this example. The brain surgeon was talking to Dr. Rangan Chatterjee, and the brain surgeon said, he said, when I get into a state of a tricky situation, he said, the first thing I do is prevent myself from hyperventilating. And I was just listening to him, and I said, okay, here's a brain surgeon. It's really intricate and delicate work. And I'm sure it's highly stressful, even though they're very well trained. And he's saying that when he gets into a tricky situation, the first thing he does is prevent himself from hyperventilating. And why does he do that? Because he knows that when he gets into a tricky situation, if he responds to that tricky situation by breathing faster, by breathing harder, by breathing irregular, his body is going to tell the brain that the body is under threat. And all the brain is going to do is want to protect him and get him out of the situation and launch him into a fight or flight response. Whenever we hyperventilate in response to a tricky situation, it's not a recipe for coming up with a good solution. It's not a recipe for being able to stay focused and to be able to deal with that situation. Now, how many students and kids going in to do exams, prior to the exam, their breathing is getting slightly faster and slightly harder and putting them into a more stress response? Or individuals going out into a football game or any endeavour, public presentations, musical performance. And we as human beings, we very often respond with a stress response because we don't know the connection between our breathing and our physiology. And this is where I will say that yoga breathing, while it's been helpful, there is so much more potential here. And the potential is enormous. And I can imagine the day that you have a student going to the yoga instructor. That student has asthma, but the yoga instructor has the specific tools to help with that person's asthma. Or that student has anxiety and panic disorder, and the yoga instructor has specific tools from a breathing perspective, in addition to poses, to help that student, or sleep, or mental focus. We have those tools, and those tools are simple. And yet, it's at this stage, it's only innovators who are using them, the biohackers, or people who come across it by accident. We do need to get into the mainstream, and I think it's going to happen because I think every kid in school needs this, and this should be taught in school. Why aren't we taught and gave the tools to be able to deal with stress? We're leaving school, we're going into university, we're going into stressful work environments, and yet we don't know the tools to help deal with that. It's really important.
Absolutely, I agree 100%. So, what about the BOLT score? I read a few years ago your book, Oxygen Advantage. I was also a chronic mouth breather, so I start practicing nasal breathing during the day, and I tape my mouth during the night. And it really transformed my life. So I really suggest to also buy this book or the last book you have written. And you also talk about BOLT score. So what is BOLT score? What is considered the ideal BOLT score for a healthy individual? And when is the best time to measure it?
So the BOLT score is a feedback to get an indication of a person's breathing patterns for an adult. And typically it involves you're sitting down for about 5 minutes or so with normal breathing. And then you simply take a normal breath in through your nose and out through your nose, and you pinch your nose and hold. And you time it in seconds. How long does it take until you feel the first definite desire to breathe, or the first involuntary movement of the breathing muscles to diaphragm? And when you resume breathing, your breathing should be fairly normal. So your BOLT score is the length of comfortable breath hold time after an exhalation. And it tells you whether your breathing is functional or whether there's room for improvement. And a good BOLT score is anything that's above 25 seconds. And the ideal BOLT score is 40 seconds. So, for example, professional athletes, so people who are in special weapons and tactics, for example, with some instructors, the goal was to achieve a BOLT score of 40 seconds. So what does it imply, though, if you have a lower BOLT score? So somebody measures their BOLT score and their BOLT score is 12 or 13 seconds. It implies that their breathing has got room for improvement. They're more likely to have disproportionate breathlessness during physical exercise. They're more likely to be breathing faster, breathing harder, breathing upper chest. They may have air hunger. So the BOLT score, it's not perfect, but it gives you a good feedback of whether your breathing is functional or not functional. And the lower the BOLT score, the more likely that your breathing has got room for improvement. So the other question then to ask is, well, when's the best time to measure it? First thing in the morning after waking. So as soon as you wake up, sit up in the bed, allow your breathing to settle, and then take a normal breath in and out through your nose, pinch your nose and hold your nose, and time it. How long does it take until you feel the first definite desire to breathe, and then to let go and have normal breathing?
Great. And so does physical training train breathing? So you said already, I think it's not the case, right?
Not always, no, definitely not. Swimming probably would to some extent, because when you're swimming, your body's underwater, so that you're breathing against resistance. And your face also should be in the water, so it's training your breathing from a biochemical point of view. But there's plenty of people who are well trained physically, but with poor breathing patterns. But the poor breathing patterns is going to hold them back. So they're more likely to have disproportionate breathlessness, exercise-induced bronchoconstriction. So this is when you have airway narrowing, which affects between 20 to 50% of the athlete population. And also we have to think about the core. You know, how many people talk about strengthening and improving functioning of the core, but they don't consider breathing? Well, the diaphragm is part of the core. And if one is breathing more upper chest with less recruitment or reduced recruitment of the diaphragm, it's going to cause core muscle dysfunction, which in turn is going to increase the risk of injury. So there's a relationship between functional breathing and functional movement. And this is the thing about breathing. Breathing is just being overlooked. People don't fully understand the potential with the breath. And they don't understand that there's a bidirectional relationship between your breathing and many other functions, including movement. So strength and conditioning coaches focusing on movement, focusing on reducing injury, but not taking into consideration breathing. Psychology, focusing on mental health, but not taking into consideration breathing from a biochemical, a biomechanical point of view, and also sleep. The sleep specialist, who is not taking into consideration everyday breathing patterns and the fact that everyday breathing is going to influence your breathing during sleep, including resistance to breathing. So I think we need to have a conversation here, you know, and I would envisage that in the next 5 to 10 years, breathing is going to be out there and breathing is going to be mainstream. And it won't have the connotations that it has had for the last 10, 20, 30, 40 years. It's going to be simple tools that everybody will understand. And I think it's going that way.
Yeah, I hope so. And I saw many oxygen advantage instructor that are also Wim Hof instructor. And so do you think that combining those two methods can be helpful in many ways? Because you said it's better to start light and slow, less is more, not hyperventilating. And so Wim Hof method is that part of the game, right? And so maybe combining the two methods, how do you see the challenge between these two culture?
And I think it's really about understanding what does each exercise do? And, if you do hyperventilation for 30 breaths and then you exhale and hold your breath and then breathe in for 10 seconds, hold, hyperventilate for 30, exhale, hold, breathe in for 10 seconds, hold, hyperventilation again, and then exhale, hold. The hyperventilation is a stressor to the body and mind, and the exhale, hold is a stressor. So this can cause the body to make positive adaptations, including improved immune functioning and immune response. But I've made mistakes with stressor exercises. I put people into panic attacks, increased anxiety. People with chronic fatigue syndrome, I've completely floored them. And so using the Wim Hof method is a tool, but it's a tool that should be tailored according to the person that's in front of you. And that's the only thing that I would say with it, any exercise. We use 26 different breathing exercises now. And there's some exercise we use with some people and there's some that we don't. And that's the thing to bear into consideration. So if you want to upregulate and if you're relatively fit and healthy and young, of course you can use hyperventilation and breath holding, but don't just rely on that. Always think about recovery. Breathing is way beyond just doing the hyperventilation and breath holding. That's one aspect of it. It's like you go into a gym, you see 20 different machines there. Each machine has a specific purpose. Well, we use 26 different breathing exercises, and each breathing exercise has a specific purpose.
I got you. And on this podcast, we often talk about longevity. It has been well documented that those who live at a higher altitude tend to live longer. Do you think that the reduced pressure of oxygen at higher altitude could be the key for longevity?
I don't know. It's an interesting question. I remember a study that was conducted by the Indian Army, and they looked at a lot of people, a lot of soldiers who were based at high altitude over many years, and their health was much better, despite they were drinking more alcohol at high altitude because they were totally bored out of their minds. And their hygiene wasn't as good either at high altitude, but yet their health was better. And I just often wondered about that, like why the individuals at sea level, why didn't they fare so well in terms of their health in different conditions? So I don't have the full answer. I think there's more to be uncovered here. And it's not about doing hypoxic training either. I think in terms of longevity, we have to be considering the stress response. The real question to ask here is, does stress contribute? I'm talking about mental and physical stress. Well, when stress gets too much, I'm talking about, of course, a certain amount of stress is fine. But when stress gets too much, that it's having such a negative impact on the individual, is it going to contribute to inflammation, sickness, and disease? And I think the answer there is going to be yes. So breathing techniques, could they influence longevity by giving people the skills to be able to counter overstress? And the potential is there for that.
Awesome, yeah. Last question before I let you go. What are the habits that have changed your life? If you can name it a
for
few.
Sure, breathing has been first and foremost. It's brought a tremendous softness and stillness to the mind. Of course, the human mind will always have some nature of thought coming in. That's the way it is, but it's the degree to which the thinking mind has quietened. Sleep, another aspect of it in terms of changing breathing patterns to improve sleep. Intuition. If the mind is if we're overly thinking and lost in thought, and quite frankly, we've become addicted to thought. And the nature of an addiction is that we simply can't stop. We cannot stop thinking. And many people cannot stop thinking. And also education has added to this because it has trained the mind how to think, but it hasn't given people the tools to be able to stop thinking and bring a quietness to the mind. If we're living in our heads, if we're constantly thinking, if we're in that fight or flight response with upper chest and fast breathing, and I was there, it's not a nice place to be. And you miss out on so much that life has to offer, because How on earth can you experience life if you're trapped in thought? And most of those people who are trapped in thought, they'll either go and they get medication to help bring a quietness to the mind, or drinking a lot of alcohol, or taking substances to bring a quietness to the mind. So, for example, I read, there's an author, Irvine Welsh, I think is his name, or Welsh, and he said, every junkie is looking for silence. And if you think of all of those aspects, well, changing your breathing patterns has helped to bring some silence. Changing my breathing patterns has helped to bring some silence and a softness and a connection with life. And ultimately, you're more successful if that's the goal. You're more intuitive. You're more creative. You're more resilient. You're able to deal with situations better. So yeah, it's a tremendous tool. It's always there. It's free. You have it. You know, you're not going to this individual paying him her month after month after month after month. No. You learn the tools. You can learn the tools from a book. You can learn the tools from an instructor who guides you through it. Once you have the tools, you have them for life. You have this for the rest of your life. So in terms of, there's so many things going for it, and it's a great little skill.
Beautiful. I was listening to your end of this beautiful episode. So thank you, Patrick, for your time. And it was really amazing to hear you personally. And I will leave all your contact in the show notes of the podcast. And have a good one. Thank you very much.
It was a pleasure. Thanks very much, Vanessa.
Thank you.